Welcome back to the News at 10. We're now being joined on the News at 10 by the Minister of Health, Professor Adewole, to shed more light on developments in the health sector. Professor, you're welcome to the News at 10.
Thank you, Gloria.
Well, in your opinion, you saw that report. What do you think has changed in the nation's healthcare sector right from the days of the country's independence?
Well, let's be honest. I'm quite excited about the presentation. And we've gone through a lot in Nigeria. And what we saw there is a true reflection of what has happened over the years. The health sector has suffered serious neglect over the years. But we must give credit to the current administration. Under the leadership of Mr. President, President Muhammadu Buhari, we've done what we call an overhaul of the healthcare architecture in Nigeria. We have improved funding. In 2015, the capital allocation was 22 billion. In 2018, it is 88 billion. So we've actually increased funding 4 times. That's number one. Number two, we have really looked critically at the healthcare architecture. Health is on the concurrent list. But government is mindful, federal government, let me say, is mindful of the need to intervene even at primary and secondary care level. Ordinarily, our function should be to look at healthcare at tertiary level, at policy level. But we realize that if we do not intervene at primary and secondary level, nothing will change. And so we've actually intervened. We decided to invest in primary care, and that brought about a determination to rehabilitate and make functional about 10,000 PCs, which is a third of the primary care centers in the country. Ordinarily, the local government and state should look after primary care centers. So far, we've done about 4,000, and we're still going to do more. There is need to intervene at the secondary care center under the purview of the state. When I was training as a medical student, without a referral letter, no one will see you in University College Hospital Ibadan. But as of today, our teaching hospital are doing primary, are doing secondary and tertiary care. And that has created a lot of congestion. We've intervened. Federal government took a loan of $500 million and has given the states money. As of today, each state in this country has received at least $2.5 million to intervene at primary care level. We've invested in the National Strategic Care Development Plan. We've changed the policy. We've developed a National Strategic Care Development Plan spanning over a 5-year period, costed for all the states of the country. And only yesterday, the Vice President, His Excellency Professor Shibaju, chaired a national steering committee to look at human capital development in Nigeria.
But you see, sorry to cut you in, but you see, in spite of these interventions, many will still say that the country is experiencing its biggest, brain drain ever, experienced because owing to lack of facilities, welfare of health workers. Are you doing something to address this?
Oh, we're doing a lot. One of the things we're doing is to discuss about packaging and intervention fund for the states, because the states really are not doing much, and we want the states to take over their responsibility. But we know that we need to provide the funds, and federal government is going above what is necessary to support the states. As I stated, in a state where the number of doctors in the teaching hospital are far more than the entire number of doctors in the state.
What do you mean by above what is necessary?
Okay, I will give you an example. In a state, we have a federal medical center, we say about 130 doctors. In the state, there are only 22 doctors to manage 24 hospitals. 1 doctor per hospital, that's not enough. So what we are doing is to encourage and support the states. But there are many other things we've taken over. We've taken over immunization, we've taken over HIV, and we're taking over tuberculosis. I'm interested in one of the reports that said that in the past tuberculosis was treated free. We are still treating tuberculosis free, courtesy of federal government. We are treating HIV free, courtesy of federal government.
Well, we must thank you very much. We're out of time. Thank you very much indeed for coming on the News at 10.
Thank you so much.